Hello, my name is Eugene Aiello. I'm a practicing chiropractic physician here in Brentwood, Tennessee. I'm producing this video series on patient education to educate my patients on exactly what I'm performing when I'm giving them treatments in my office. I understand I have a unique approach that my visits are not the same as an average chiropractic visit, and I wanted to discuss a little bit about what I do so people fully understand it after they leave my office. Also, I'm going to be producing additional videos that are educational on things I don't get to speak at length with my patients, mainly regarding lifestyle. I think lifestyle is the reason people end up in my office in the first place, and my hopes is to educate patients on how they can maintain their own health and not need regular chiropractic treatments. I think that lifestyle modifications can not only keep you away from the chiropractic office, but also get you out of the other offices needing pharmaceutical interventions and the things that we'd all like to avoid in a healthy lifestyle. My approach is a bit different than the majority of my profession. I incorporate chiropractic manipulations and cold laser therapy primarily to correct postural muscle imbalances. Unlike a physical therapist that would just be working with strengthening and stretching and different stabilization exercises, I don't believe that just treating the muscular system through that method is going to be effective at correcting root causes. I believe the root causes of postural tones lie with dysfunction in the nervous system. The central nervous system is controlling your postural tone. And by addressing the dysfunctions, you can correct these posture tones and aid the process with stretching and exercises at home. I also believe in soft tissue manipulation. Deep tissue massage is a part of my treatments. Obviously, people don't present to me when their muscle imbalances first begin. Usually, I'm not meeting that patient until years of imbalances built up. So just purely correcting the central nervous system dysfunctions, the postural imbalance, isn't going to give the complete relief of the problem. It's going to be necessary to work the muscles and give home exercises. So I'm going to start with this video by discussing my approach to chiropractic, which is different than the majority of chiropractors. There's two different philosophies in chiropractic. One is the subluxation model, which is the dominant model, and I practice more of the joint restriction model. Subluxation model talks about vertebra going through misalignments, rotations, tipping of the vertebra, and these are going to result in minor nerve impingements. So you're going to a chiropractor, you're getting an x-ray, they're looking for subluxations and trying to make spinal corrections. Early on in my education, I was learning a lot about research in the field, and they were never ever proving, chiropractors are never able to prove that when they found a subluxation, that a manipulation ever restored that vertebra back to the position. So that theory has never been proven. That's kind of where the divide lies within the medical profession and chiropractic. If someone truly has a subluxation, a misalignment of vertebra that's causing a nerve impingement to the point the patient's exhibiting symptoms, that's going to be a surgical procedure. And in certain circumstances, these things do happen with scoliosis, with fractures, different things like that. But day-to-day living resulting in subluxations causing minor nerve impingements, which don't give a neurologic symptom. What I mean by that is severe numbness, muscle atrophy from muscles not being innervated by that nerve. That's not the common. And that theory proposes, excuse me, that restoration of spinal alignment is going to optimize circulation, communication within the whole nervous system and the body, which in a holistic approach, I do believe that. I do believe that people are presenting to my office because the communication system within the nervous system in the body is disrupted. But restricted joint motion theory talks more about when these spinal joints, when I say spinal joints, I'm not talking about these discs in the front. On the back of your spine, you actually have joints, and those joints guide the different motions within the vertebra. Restricted motion theory says that when those joints aren't moving, it's decreasing input from those spinal joints about position sense. It's referred to as deafferentation. As those vertebrae are locked up and not moving, those sensory nerves actually become weaker since they're not firing, which causes multiple neurologic issues that Yeah, well, we may get into in one of these videos, but today I'm going to keep it very simple. So deafferentation model talks about the binary sensory nervous system input being decreased. The biggest inputs in our sensory system are proprioception, which is coming from joint position sense. Basically, every joint in our body, those joints in the spine have receptors. Every muscle in our body has receptors that's constantly sending input to the brain about position of the body. In this schematic here, it looks very complicated because there's a lot of details I'm not going into in this video. But what you're looking at would be the cortex, just a very general diagram of the brain, the thalamus, and then your spinal cord. Every sensory input that comes into the brain is going to stop in that thalamus first. It's a sensory relay station. The only thing that's going to skip it is sense of smell. The next biggest input after proprioception is vision, then hearing. All other sensory inputs are pretty minimal compared to those three. So chiropractic kind of jumped on the bandwagon of saying, well, wait a minute, spinal joints have a lot of receptors, especially upper cervical. Upper cervical are extremely densely populated because they're telling us where our head is in space. There's many reflexes you don't think about day to day that begin with knowing where you're at in space, orienting towards your head. So as any of these inputs decrease, and we're going to talk about proprioception as the spinal restriction theory talks about, it decreases input to that thalamus. Now that thalamus is a very important structure. Further videos or videos on my biophotonics series gets way more into detail about the mechanics of the thalamus. We're going to keep it simple today, and I'm just going to talk about how the thalamus processes all sensory information in an interneuron network, so neurons which connect that neuron to the neurons of the brain. From there, those nerves are going to fire to different areas of the cortex. When I say cortex, I'm being very general. That information is going to fire to your cerebellum, your brainstem, and your main cortex. But for the diagram, I'm not going to put all that in there. So we have something called a thalamocortical loop, basically, that's created from the thalamus communicating to the brain, and then the brain is actually coming back and communicating to the thalamus. This rhythm, this loop, if it gets disrupted, it's called a thalamocortical dysrhythmia. Thalamocortical dysrhythmias, well, you're not going to, but I do research in this area, you're going to find that neurologic disorders are getting added to this list, meaning through imaging, through electrical studies of the brain and some imaging, they are finding that if this loop is dysfunctional, meaning it's out of rhythm, you're going to see different disorders like Parkinson's, Alzheimer's, tinnitus, different pain syndromes are popping up on there. When I was being trained in this technique with the neurologist I worked with in school, he was primarily treating things that were outside the ordinary of a chiropractic office. He was seeing attention deficit kids, dyslexia, and the theory being, if you start sending big bursts of input into that thalamus, you might be able to reset this rhythm and get different firing patterns within the brain to correct. So we're not going to go too far into that. There's other fields out there. I know patients ask me a lot about biofeedback and brain mapping. They're basically working with the same concept, but they're working on this cortical thalamal loop here. If they're getting people to process things differently, they're going to start getting activation of that loop. So thalamocortical dysrhythmia is a big topic in neurology at this point. When I was learning this technique from the neurologist, I was not interested in all of the neurologic disorders that he was working with, but I was primarily interested in sports med and orthopedics. And when I was working with him, he described that one of the evaluation methods, how they figure out which thalamus, left or right, is dysrhythmic, is posture tone. He would do different muscle testing. So when someone has a thalamocortical dysrhythmia, let's say on the left brain, they're going to exhibit a left postural tone on the left side of their body. Midsection up, the muscles in front are going to take on too high of a tone. The muscles that oppose them will take on a weaker tone. Lower body, it's the opposite. Muscles in front take on that weaker tone. Muscles in back take on the tighter tone. When I was learning this with him, I said, oh my goodness, if you think about this, almost every orthopedic condition that you would run across in practice would make sense that this postural imbalance would be the cause of it. So as a chiropractor, the first thing that stuck out in my mind was the lower body. When you have weakness in front and tightness in back, that's going to cause pelvic misalignment. When someone's pelvis misaligns, it puts a lot of stress in their sacroiliac joints. most common thing that's popping in my office on a daily basis is people coming in with low back pain. That low back pain is caused by those joints being misaligned and stress on those ligaments. Going back to our subluxation people, when someone's pelvis misaligns, their pelvis is going to tip to one side and their sacrum is going to rotate. Your spine is sitting on your sacrum, so that tip and rotation is going to have to be compensated for by the vertebra. So when you shoot an x-ray, you're going to see all kinds of tips and rotations, and they're going to call them subluxations, but they're really the result of correction from the postural imbalance creating a pelvic distortion. So I don't know, the analogy I always use for people is if you got a crack in your foundation, messing around with the drywall cracks upstairs is not going to get corrected until you correct that foundation. So right off the get-go, when I was learning this technique, I thought, wow, this explains pelvic distortion and all the different spinal things that people get from that. And we're not aligning the vertebra, we're aligning the pelvis by adjusting for posture tone. So other than that, if you think of all the tendinitises, tennis elbow, the weakened muscles, golfer's elbow, the tightened muscles, the thoracic outlets, the impingements, they're very common that people think they have a disc herniation, all relate to this. So all those years of practice, 22 years of practice, this technique was amazing. Meaning I would have patients come in the door and they'd have a muscle imbalance. Let's say it's the right side of their body. I'd be focusing on spinal restrictions on the left because all sensory information crosses over. So if we've got a deafferentated joint on the right side of the spine, we're going to exhibit on the opposite side of the body a muscle imbalance. So pretty exciting. I found that technique to be quite amazing. But I started noticing, I'm going to say in the summer of 2019, well, it was the summer of 2019, that spinal manipulations didn't seem to be as effective as they'd been for 22 years of practice. It was taking me longer to get people better. I was also seeing that predominant presentation was different. And what I mean by that is I usually would see a spinal distortion on the right side of the body as the common, but I started seeing everybody predominantly on the left. Quite the quagmire. At the time in my practice, I trained students and I trained them specifically in functional chiropractic neurology techniques. We were all pretty perplexed on this issue. So we ended up trying to do our treatments a little differently, and we incorporated the cold laser treatment more in our basic treatment plan. In Chicago, when I was in practice, I was also an acupuncturist. So I would use that to treat many different things that functional neurology, basic posture, tone, and balance corrections were outside the scope, such as like an irritable bowel patient. I would use acupuncture. But one of my students had approached me about this idea that might help us resolve why people weren't responding to treatments like they used to. And it was a massage technique that also incorporated acupuncture lasering of certain acupuncture points along muscle patterns. When we were experimenting with this technique, we found something kind of interesting. When I used the laser on the opposite side of that imbalance, so I'm going to say someone had a left-sided muscle imbalance that wasn't responding usual to my chiropractic, when we applied the laser on the right side of the body over acupuncture points, we were seeing a neurologic change. It was actually facilitating the muscle correction. Well, this got me going in many directions because I had a lot of questions about how acupuncture actually functions. The meridian system, I knew there was something to it, this energy and channels. I never could explain it. I always believed it was electrical in nature, that our body had an electric system that was poorly understood because it was such a low level of electricity. When I started finding that this laser was working as a neurologic stimulus, it kind of hit a light in me going, oh my goodness, maybe this is acupuncture is functioning by a neurologic component, which is the main Western view of how acupuncture is happening. So when we first made this discovery, I was using a cold red laser on people's hand. Biggest stimulus, like I said, is cervical, upper cervical especially. So we were finding it was beneficial when we used it in the hand, but if I used any acupuncture points in the legs, it didn't seem to affect neurology the same. So what I was doing was using a red laser on points that we would call the large intestine channel in Chinese medicine, the triple heater channel, small intestine. Don't pay too much attention to the names of these. And I was finding that red laser would bring a neurologic change for people. Then it hit me one day, the red laser, is but on channels that in Chinese medicine are associated with the fire element. With Chinese medicine, every acupuncture channel has an associated element to it, meaning it has specific nature. That qi had had the nature of fire, whatever that means. You know, going through acupuncture training, it's all pretty obscure, and a lot of it you don't know if you're losing something in the translation Chinese to English. So it hit me one day, maybe I should buy different colored lasers that correspond to those different elements. So I purchased an infrared laser, a yellow laser, a green laser, a blue laser. And we started playing around with the different acupuncture points and channels, and we were finding there was not consistency. The red was consistent up on those upper points, but when I was in the legs using the different frequency laser that should correspond to the channel, I wasn't getting a response all the time. Sometimes I did, sometimes I didn't. Then it occurred to me, maybe these are not working by the acupuncture points. And I started tinkering around with the dermatones. What a dermatone is a specific area of sensory perception on the body that correlates to just one spinal nerve. So every vertebra has a different nerve level to it. And I started thinking, maybe this red dermatone, so C6 dermatone, C7, C8, maybe those dermatones respond to red. So I started experimenting with the different colors on the different dermatones. And I did find a consistency that green and blue seem to affect different dermatones in the legs and in the thoracic area, which did not correspond to the Chinese theory. So at that point, I made the bridge and thought that Chinese theory probably was using qi. Qi probably was electromagnetic energy within the body, that these different frequencies of light were somehow traveling in the body, but they weren't traveling through meridians, they were traveling through the nerves. So with that thought, I'm trying to picture how you'd have to have a continuous network following those nerves. Nerves will have little gaps in them. That's where the synaptic cleft is. So when a nerve is firing, it's going to release chemicals, neurotransmitters, that are going to induce that next nerve to fire or not fire. But we do have a system called glial cells. Glial cells wrap around every single nerve in our body. Glial cells outnumber our neurons in our brain 6-to-1. We have a lot of glial cells. Conventional science says that glial cells, in Latin glial translates to glue, glial cells are just what hold the nervous system together. I started theorizing, maybe that's not the case. Maybe electromagnetic energy flows through these channels, and when I'm stimulating those different laser points, maybe somehow I'm stimulating the pigment system and that energy is transferring through. So I started developing a theory on this, and I started following it. Every direction I walked in, everywhere I looked, I started finding that quantum physics, biophotonics, fields that are studying electromagnetic interactions in the body, are already finding that the glial cell system emits different frequencies of light. Every cell in our body emits different frequencies of light. The conventional view is that these photonic emissions coming out of cells is just the result of metabolic processes, that's just a wasted energy that's escaping. I started to think maybe there is more to this than just that. Somehow, when I'm stimulating nerves, just like I would in this situation, proprioception through a spinal adjustment, when I'm using cold lasers, that cold laser is somehow having an effect on the thalamus. It's having an effect on that postural muscle imbalance. So I started turning my research into a book. I wrote a book on what I believe this biophotonic model is and how that correlates to neurology. So when a patient comes in my office, I incorporate both spinal manipulations and cold laser therapy to, how should I say, speed up the process. When I implement cold lasers along with the adjustments, I'm finding that these muscle imbalances that I've been talking about, they rapidly respond to my treatments. More importantly, it seems like they hold longer. So cold laser therapy as a neurostimulus has been quite the change in my career. A lot of my patients are coming in, and on the first visit, I discuss this with them, but I think it's one of those concepts that's kind of outside the box that they've never heard of. Anything out there on cold laser therapy, and even beginning in my career when I was using cold lasers, it all talks about how cold lasers stimulate mitochondria. The red frequency will get mitochondria more active, so healing tissues will respond quicker to this. The only issue I ever had with that was cold lasers don't penetrate any deeper than the skin. You can go and buy yourself a $60,000 cold laser unit. All it's going to be is an increased intensity. The frequencies are the same as you would buy on just simple handheld lasers like I was using, the basic acupuncture lasers. Penetration of laser energy has nothing to do with the intensity of the laser. It has to do with the frequency. So different light frequencies penetrate the epidermis deeper, but they don't pass the epidermis. So that energy is not getting the muscles. It's not affecting the mitochondria directly. So there's an indirect effect, and I think that indirect, well, I don't think, I'm proposing and I'm theorizing that that indirect effect is having a neurologic effect. And that's a pretty new theory in the field. I've looked at all the different research, and there really is nobody talking about this at this point. So it's pretty exciting. But going on the other part of it, a lot of patients are also nervous about cold lasers because it's radiation, and they're concerned their side effects. The cold lasers that I use in my clinic are 5 milliwatt lasers. To put that in perspective, if you go out in the sun, you're getting about 25 milliwatts of multiple frequencies of light. And if you're near a microwave, you're getting about a 5 milliwatt exposure about 2 inches away from it, but that's of a different frequency. Those are radio frequencies, which, as we'll talk in later videos, EMFs, radio frequencies, those can be harmful to the system. So that's what I wanted to conclude or cover in my first video. As I get through these videos, some of them are going to have less to do with chiropractic and cold lasers, and more of them are going to have to do with lifestyle, eating habits, exercise, stretching, routines that you should be going through on a daily basis. As I get through this series, I'm sure that I'll start talking about topics, common things people have questions about. But I hope you enjoyed this video. I'm going to have plenty more added, so subscribe to the channel so that you get updates on when a new video goes up. And please tell your friends and share. Thank you.